Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. This weekly broadcast is developed by and produced by Cities Changing Diabetes volunteers from here in Houston and our sister city, Philadelphia. Philadelphia just recently joined our global network of 25 cities working to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of our live broadcast is to help people with diabetes and their caregivers successfully transition during these very challenging times of COVID. Each Saturday, we gather diabetes care experts to discuss and to share their incredible knowledge about diabetes. They have years of experience in self-care, medical care, public health, community health, and advocacy, and will bring this knowledge straight to your waiting eyes and ears. We hope that these conversations will give you the tools to build skills to manage diabetes and to live your best lives, not only surviving, but truly thriving and doing the things that you want to be doing. Today's episode is coming up right now. You don't want to miss this. As a disclaimer, the content shared today should not be used as a substitute for the professional medical advice, diagnosis, and treatment provided by your care professional. Hello to all our viewers, our champions, our warriors, and supporters on MyDiabetesHQ Facebook and MyDiabetes YouTube channels. Thank you and welcome to our show. This is the 8th episode of MyDiabetesHQ Live. Last Saturday, we began to discuss health literacy from the person with diabetes point of view. Today, we will be talking about fostering health literacy in the clinical environment and with the clinical team communicating with patients and people living with diabetes. Health literacy has the ability to bring together all aspects of diabetes care, from the way that appointments are made, to getting to the clinic, to learning about your diabetes, and especially to driving and supporting really good communication between yourself and your clinical care team, all of whom are dedicated to helping you live your best and healthy life. During our conversation, we'd love to have you viewers let us know what you're thinking. Share your stories, ask questions. If something strikes a vein, just get on, type a comment down at the bottom, and we'll get right to it. We'll try to get to as many of these questions as possible during our time together, but even if we don't answer your questions on live, we will get to them after, and you never know if your question will be the subject of a broadcast later. So today, I'm joined by Serena Valentine, Peer Program Coordinator for Houston Cities Changing Diabetes team. Hi, Serena.
Hello, good morning.
Good morning. Serena and I are hosting from stormy Houston today. We are joined by Dr. Annette Gadabeku. Hi, Dr. Gadabeku. How are you?
I'm well. How are you?
I'm well. She is a family medicine physician and associate professor at Drexel University College of Medicine. Next, we have Susan Cosgrove.
Hello.
Hi. She's Director of Health Literacy at Healthcare Improvement Foundation in Philadelphia. And we are also joined by Katina O'Leary. Good morning, Katina.
Hello.
Katina is a licensed master social worker. She's also the president and CEO of Health Literacy Media in St. Louis. So we have almost coast to coast here. I'm sure we have some viewers from the West Coast as well, but we've got a little bit of everyone: Philly, St. Louis, Houston. So today we're going to begin by having a conversation. We'll review the definition of health literacy and share tips for improving communication between physicians and patients, and also to include care team members. Remember, just leave your comments for us. So do you want to start from the definition, Susan? Because you just gave a fantastic definition to us last week.
Yeah, so we'll start with the definition, and we'll use the same definition that we used last week. So there are lots of definitions out there, but the one that I like, because it is pretty health literate itself, is that health literacy is the ability to find, understand, evaluate, communicate, and use health information to make informed decisions about your health. And it really encompasses everything that a patient needs to be able to do, to know, to understand, to take care of themselves and stay healthy.
Super. And Katina, I know that you have a nice way of sort of taking that and pushing it forward into our conversation today.
Sure. So I think that is, as Susan said, one of the best definitions from an individual perspective to think about how a person would do what they need to do to manage their own health. But today we're really focused on how providers can contribute to individuals' health and also community health. And so thinking about how do we take that definition and make it work for people who are working in systems, so physicians, care teams, but also sort of the broader structural components. So institutionally, how to provider systems and public health systems use information in a health literate way to make it work for people to make good decisions. And so I think that's really the additional information this week from last week. So I'm excited to talk about that.
Mm-hmm. All right, so Dr. Gadabecchio, can you begin to kind of to share with us from the physician perspective how you use that and how you use it in your systems, like Katina was saying, how you see that woven?
Right. So it's really important for physicians to understand that health literacy is really a universal concern, a barrier to managing patients and making sure our patients stay well. And it is something that needs to be considered for everyone, no matter age, no matter gender, no matter even education status, employment status. All patients need to have a consideration of health literacy. And what health literacy means to providers, often we think about, oh, can someone actually read instructions or know what to do? But it's really beyond that. And that definition really focuses on that finding, evaluating, communicating information. So from a provider's perspective, we really need to think about the patient's experience really from the time they enter whatever clinical space, whether it's your office or hospital, to the time they leave that space. Some things that I would consider to think about are preparation of your space, preparing your patients, and really prompting your patients. So kind of 3 P's: prepare your office, prepare your patients, prepare and prompt your patients. So in just thinking about preparing your space, thinking about just even how your space looks, the setup, the arrangement, signage, how well or easy it is to read the signage, making sure things are at eye level, the size of fonts, illustrations, also preparing your staff. Who's the first person that the patient comes to interact with? Is front desk or information station, whoever that greeter or that first person, and any person that they interact with throughout their visit is going to have an impact on their health literacy that you really don't think about. So making sure your staff understands, the type of patients that are coming through, their needs. Doing staff huddles, I think, are very effective in preparing the staff for what to expect, to make sure that we think about specific issues, barriers, trying to anticipate needs of patients. I think that's really important and often sometimes taken for granted, especially now in the time of COVID, even just preparing your patients for what to expect when they come to the office. Anytime someone's caught off guard, either by a poor attitude or just an unexpected way of doing things, we have new protocols now with COVID. It kind of throws people off, and then they're not really concentrating on what's going on with them and their visit. So making sure your patients know that there'll be a certain way that they'll have to come in, that they need to wear a mask, whether or not they can have a support person in there with them, how the flow might be, how exam rooms might be, and just, making sure that they're aware that things may be a little bit different from the time they came in last time. Using reminder calls, things like that, to reach out to make sure that they know that their patient, their appointment is coming and what to expect during that visit. So I think that's a great way to start, just to even start thinking and preparing your patients to really receive care and receive the information that they're going to get during their visit that day.
Yeah. I like how you explained that, it's the idea of being a clinician, being a physician, and sort of thinking about the patient experience, in segments, so that you can prepare your staff from the scheduling standpoint, from the meeting and greeting, all of these. Katina's team has created some very excellent videos on health literacy from the patient perspective. And I really like that you said to use as a prompt and for experience, because I figure we can use this as a prompt so that we can share with clinicians the patient experience. Katina, can you kind of prep us for what we're about to see?
Sure. So we created a set of videos, as Joy just said, that are really supposed to be very friendly to the public. And so they're based on a lot of memes that people would see in social media and videos, and we sort of played on those for humor. So this one was created back when people were doing sort of all the public dance sort of situations, but we wanted to really focus on what's okay to ask your doctor, and the reality that you as a patient have the right to ask for what you need, and help people understand the kinds of things that are reasonable to ask for and how they might prepare for a visit. And so this short, I think 2.5-minute video really, in a funny, lighthearted way, helps people think about that.
Let's take a look.
Clayton, what are you doing?
I have a doctor's appointment tomorrow, Kendra, and I've decided to communicate and interpret his dance.
What?
Well, nothing else works. My doctor and I never understand each other. Last time she told me I have a pickup truck in my watermelon.
More than 90 million Americans have trouble understanding health information. Did you know that communication issues between patients and providers is the main cause for unexpected deaths and fatal injuries? Here are some healthcare hacks for what to do when your provider uses words you don't understand. 1. Speak up when you don't know the meaning of a word. If they say, you might say, I don't understand that word. What does it mean? 2. There's no shame in not knowing every difficult word in someone else's profession. You probably didn't go to medical school, so how could you know all of those words? 3. If your doctor says you have an illness or condition you aren't familiar with, have them explain it and how it might affect you. 4. Teach back. Repeat your doctor's instructions back to them in your own words to check for understanding. If there is a word or concept you don't get, they will have the chance to clear up any confusion. 5. If your doctor says something you don't know, like, ask them to write it down on a piece of paper so you can look it up later. It's all about plain language. Remember, you and your healthcare professional have the same goal in mind, to keep you healthy.
Well, I guess all my dance moves are going to waste. Or maybe not. This is going straight to YouTube.
That's great, Katina. Thank you so much for allowing us to share that. I think that it gives people a starting point, Dr. Gadabeku, to what you were talking about, right? So the experience of the person is very important to their health, and we have a role as clinicians to improve it and make it better. So if we could break down, team, if we can help break down Dr. Gadabeku's summary, like point by point, right? So first point being, it's something that impacts most people who wants to take that and roll with it.
Well, I can start with that. The reality is that the data that we all talk about is from a survey that was conducted in the U.S. about 20 years ago. So it's pretty old data. But 20 years ago, they called people on the phone and they did surveys in your best situation when you weren't feeling bad. And they talked to you about your literacy and your understanding and your health information. And about 9 of 10 people said they had challenges doing the things that we're required to do. But if you think about that, that's when we feel okay, and when we're answering questions and when we're sort of focused on helping a surveyor understand. In our real lives, when we feel poorly, when we have the flu or we have a cold or we're getting a new diagnosis like diabetes or heart conditions or cancer or any of those things, that 9 of 10 is probably an underestimate because it's new information and it's scary information. So you have to learn for the first time how to change your life, perhaps pretty dramatically. So what I would say is the 9 of 10 already is almost everybody. But the reality is when we're sick and confused and upset, we're all in that boat where we really need help, and we need people to slow things down and think about what we need to know and give us that information in chunks so that we can process and understand how it applies to us. And if we think about it from that perspective as providers, then we start every interaction with the assumption that this is going to be hard stuff and people really need us to be compassionate and empathetic and thoughtful in the approach. And I think that's what we were hearing earlier when we thought about preparing patients from the moment of their visit, because the expectation in every visit is that you're going to address something that's complicated, and people need some support with that.
Yeah.
And to elaborate on that point, and also building on something that Dr. Gadabeku said earlier, not only is it about the individual skill level, it's about the expectations that we have of patients when they're interacting with the healthcare system. So it's individual skills interacting with sort of the system and the situational factors. And so, Katina, I think you did a great job summarizing the findings of that survey that indicated that, a lot of people didn't have the highest level of skills. And I think that the other piece of this is that the healthcare system is designed for people who have that highest possible sort of literacy and health literacy skill set. And I think that's where this conversation comes in, is that we do want to do everything that we can to make it easier for patients to navigate and communicate within a very, very complicated system.
Well, and to sort of follow up, again, Susan and I could play on each other with this all day long, I think. But even with the highest level of skills, it's still hard. So I would challenge that if, me or Susan or any of us on this call we practice health literacy skills all the time in our work. If we're the person sitting in the chair for the first time hearing about our own health condition or our children's health condition or our mother or father's health condition, we're back in the chair as a patient who is at that lower level of skills because we have to study this and learn it for the first time. And I've personally seen this a couple of times with both my board chair, who was a surgeon for many years, had a pancreatic cancer diagnosis that ultimately ended his life last year. But when he first got the diagnosis, he was back like a person who didn't have any medical training, right? So he was calling friends and family. He was trying to understand, make decisions that were out of his context as a general surgeon, because he was not a person who had pancreatic cancer before, obviously, and he didn't know other people in that situation. So, even when you have a lot of skills and experience, when it's it's a whole new thing, and the system requirements are enormous for everybody. And it's not just the care system either. It's the health insurance system that you have to navigate for cost, and also the public health system. So COVID is a great example of this. We're navigating all these new rules that are coming from local, state, and federal governments that are often conflicting, and we have to figure out all that. So I think it's fair to say this is sort of rocket science for people, and it's all of us all the time.
I'll just put a face to that. I know that's one of the things that I know my team wanted me to share some personal stories. So one personal story is about myself and also being a patient several years ago when I broke my hand. And I'm a doctor and I had issues with navigating the health system. I remember, just trying to get appointments and referrals and whether I needed my referral and what my insurance covered and didn't cover, and physical therapy, occupational therapy, like all these different things. And it is overwhelming. And again, I have a higher education degree and it was still difficult for me. So it is not respective of person and any skill level. It really is, I would say 100%, more a 10 out of 10 than a 9 out of 10.
And so I think in those types of situations, would you say to my amazing health literacy expert colleagues here, would you say that part of our roles as clinicians would be to learn some of those ways to navigate, say, insurance systems, like you said, Dr. Gadabeku, potentiating a need, right? And then investigating it ourselves and then kind of guiding someone, because I find myself telling my patients ahead of a visit, we'll have an insurance verifier give you a call. They're going to check on the codes, make sure that the diagnosis, and they'll call you back with an estimate of benefits. And I feel like not having a crazy bill drop on top of them, on top of a new diagnosis, sort of, and all that fear that comes along with the unknown. Would you all say that that's part of our role as systems?
I would say so. I'm not a clinician, but even in interacting with other people and peer support, I pretty much pretend that each person I'm talking to does not know anything. That way I can put myself in a position to just explain in case they do not feel comfortable asking, because I hear a lot, well, I don't want anybody think I'm stupid, or, and, of course we all know that's so far from the truth. We don't think they're stupid. We just, a lot of times we assume that they know what we're talking about. And I just put myself in a position to assume that it doesn't matter who it is I'm talking to, that they don't know anything. So I just explain everything off top and then ask, did they understand what I explained to them after that?
I think anticipation is really key in what we're kind of talking about. And it's even harder for us as healthcare providers if we haven't experienced it. It's hard to even know what to anticipate to actually help our patients along. So, for example, telehealth right now. Telehealth was new to a lot of us as even providers and then as patients. One thing that we had to do, we actually had telehealth and we actually changed our health record system all in the midst of crazy COVID, which was a big challenge. But one thing that was helpful was for us as providers and our staff, we encouraged all of us to sign on to the health system as a patient and go through this process of what it's like to, sign up for the app, download the app, get onto a video visit. So we can know where the challenges lie and how to help anticipate and help to prompt our patients when they're struggling trying to get onto the system, or even troubleshoot, tell them ahead of time or while they're struggling within the system trying to get onto their visit, how to instruct them of what to do, where to go, what to press, what to download, all of those things. So if there's any opportunity for us to experience the healthcare system for ourselves, even if it's not what we need to do, but just to go out of our way to actually experience it, we can be better advocates for our patients when they do struggle with the healthcare system.
And I love that both of you, Serena and Dr. Gadabeku, you both described, putting yourself in your patient's shoes, or putting yourself in the position of thinking about it and looking at things from the patient's angle. And I think that's really important. And all of the tips that we recommend around health literacy are all really in service of empathy and of building that good relationship and building the trust between patient and provider, so that these conversations and this understanding can unfold and can take place. Like, as we talked about last week, health literacy is not something that you're supposed to be doing at each other or talking past each other or, checking off a box that you did this technique. It really is about building that relationship and that trust so that the understanding can happen.
Go ahead.
No, I was just going to say, as people talk about all of these things, though, to me, there's the idea of sort of managing people's expectations. And if we know what to expect, so many of us are much more able to sort of show up in a powerful way and be prepared to ask the questions we need and feel comfortable in relationship. And so I think that's much of what we're talking about, is how do we do what we need to do as providers to make sure that we help patients by managing their expectations and putting them in the optimal situation to have a good visit and get the information they need to manage their own situation.
Super. And so we would all, I think, agree that all of these things together, even though you don't, I guess, think about them individually, right? As a clinician, you think about them all together because a patient has to have an appointment. They have to take their medications. They have to know about their disease. Everything kind of happens all together, right? So when we think about it, how important is health literacy, or the different strategies that we're going to talk about soon? How important are those, and how do we see them sort of manifested in someone's health?
So I'll start. It's all very important and definitely has an influence in someone's health. From some of the things we talked about, and just not being able to hear some of the information that that the provider is giving. It manifests in just trying to have to often be, first of all, be very patient, making sure that people are free to ask questions, actually prompting for questions. What questions do you have? It's also been manifested in patients taking the wrong medication or in the wrong way because they didn't quite understand the instructions. I've had that happen oftentimes. Even just patients, for example, for diabetes or high blood pressure, someone might say, okay, you're going to take this medication, and they think it's for a temporary time, like an antibiotic. And so, I only have it. I got 30 pills. That's for a month. So after the 30 pills, I'm done. I didn't know I had to go get a refill, or the way the instructions were to take 2 pills a day. They took it in a different way than what you wanted them to take it. And so we do see it. And sometimes it's misinterpreted as non-compliance or non-adherence when it's just a miscommunication or misunderstanding. And so someone didn't take their medication, and or they didn't go follow up with a referral. And it was more because they might not have understood the instructions or the process, rather than them just not wanting to do it or being neglectful of their health. Multiple admissions to hospitals, recurrent admissions to hospitals. Those are some of the manifestations that we see, amongst many. This is only a few examples.
Yeah. So one of the things that we started. Oh, go ahead, Katina. I'll say after you.
I'm so happy to hear you make the comment, though, about noncompliance and non-adherence, because it's so frequent that patients don't do what we've told them to do or what we think they've agreed to do, and it gets labeled in such a way. And I worked for many years in substance abuse, and if people didn't do what they were supposed to do and they were non-compliant or tagged non-compliant, it meant that they didn't get other options for treatment because people felt like they couldn't be relied on to follow the guidelines. And when you look at it from a health literacy lens, you realize that it's not necessarily that they didn't want to, but maybe they didn't have maybe they weren't ready, maybe they didn't understand. There are all these other pieces that sort of pile on. But once you're labeled non-compliant or non-adherent, there are consequences to you in your real life that really make a big difference. And so it's just so refreshing to hear you as a clinician really call that out and clarify how important it is to think about this from a patient perspective.
Yeah, and I mean, birds of a feather, right? We're all here together, and this is something that we all feel very passionate about. I honed in on that exact comment as well. I walk around, and I work in a teaching clinic, and with residents and attendings and fellows, and one of the things that I think is really important to remember as as a veteran clinician is that we have to model these things, particularly not labeling someone as non-compliant if we really don't know the reasons that their care has been challenging. And so one of the things that we started at my clinic with patients living with diabetes is a very simple change. We changed the way that we write down on their glucose logs when they take their medication. So it's very explicit. We put down which insulin they're taking. Sometimes I even color code it because some of them are, the pens are different colors. And then we put with breakfast, before breakfast, and you put the doses at each of those time points. And then what happens is patients and clinicians benefit because now we know what we've told the patients. We know when the patients have taken it, and the values that we can see from there are impactful because they mean something versus just numbers that you're saying, well, you haven't been compliant, or, I cringe every time I hear that word. Perhaps non-adherent because of some challenge, but non-compliant, people are at your appointment at your clinic to do something about their health. It's very, very important that we model those behaviors for the people that we are teaching, and our patients and our staff and our support crews. So thank you very much, Dr. Gadbeku, for bringing that up. It's my soapbox every day at work. They're like, don't write down non-compliant. Joy's going to come get you. I'm like the non-compliant police.
And sometimes it's the why that people are labeled non-compliant because I hear a lot from our participants that, well, I don't know why. They didn't explain why, so it must not be a big reason why. For example, I'll use myself for an example. If I go into one of my appointments and say, for example, that my A1C has gone up a little bit, and the doctor tells me, Ms. Valentine, we're going to have to add another medication, so I'm going to write this medication, send it to the pharmacy, go take it. My first question is going to be, why do I need to take another medication? Some people may not ask why. Some people will just say, well, I'm not doing it, but if they know why the doctor's trying to, get that A1C down, if they understand why and why they need to take their medications on time, why they need to eat right, why they need to exercise, what does it do for your body, then to me, they're more equipped to make the right decisions on their health and what they need to do.
And in fact, one of the communication strategies that we recommend for patients and that we talked about last week is the Ask Me 3. So that is recommending that patients ask 3 questions with every visit. So what is my main problem? What do I need to do? And why is it important for me to do this? And that third question is what we're talking about here. And it's so important for patients to understand that, so that they can have not just an understanding of what they need to do, but the motivation behind it to do it as well. Just as you were saying, Serena, like that, I think is what really unlocks action for a lot of people, is understanding not only what they need to do for their health, but why exactly it is important for them to do that.
Mm-hmm. And I think, Susan, last week you were saying, and this is a big, big thing, is that health literacy is not something that we do at our patients, right? And so if a patient comes to you and you prepare them and they're more health literate and they're really, really engaged and they're willing to ask those 3 questions that you just put up there, what do we have to do as physicians as clinicians? Because if they're going to ask, shouldn't we respond?
Yeah, I'm happy to start us off, and everyone else can jump in because I know we have lots of tips and tricks from this group. The first thing that I will say, kind of the starting point is really speaking in a way that people can understand. So using plain language or living room language, talking to a patient like they are a person, like they are a human being, not like they're a robot that should understand kind of all of these different complicated inputs. And when possible, avoiding using medical jargon if you can, but if you must use it, making sure that you define those terms. I think that we always hammer the message like simplify, simplify, simplify. But Joy, you made a great point around kind of medication instructions and how sometimes fewer words is not always better. So really use the number of words you need to use to get your point across clearly. So take your medication twice daily is fewer words. It's a simpler sentence than telling a patient exactly how to take the medication, but saying take your medication at 8 a.m. and 8 p.m. or take one pill at 8 a.m. and take one pill at 8 p.m. More words, but much, much, much clearer. And as you saw, much easier for a patient to understand.
So do you use, Dr. Gadabeka, do you use any of these tips here, like feedback, or, because I know I use some of them. I might not use all of them because that would be really awkward. Like, I'm going to tell this to, do we need to use all of them, or can we just use some of them, one of them?
No, yeah, as many as you can, and every patient and every patient situation is different. So I definitely try to use plain language, avoid medical jargon, explain medical terms. I like to actually use illustrations. I'm not a great artist, but I'm a visual person. So, and I know people learn differently. Some people hear and are able to receive the information better. Some people need to see it. So using different modalities in trying to explain what is going on with the patient or instructions. So, and a lot of, one point you're kind of bringing up is, so we have to do all of this and ask all of these questions, and that takes so much time. And that's one of the pushback I hear, especially from my trainees, about the time, and but making people go back and ask these questions and get better understanding. And, why didn't they take their meds? Why are they not adhering to their, what is the social situation? Getting more information is really important. But I know we as providers are so constricted and stressed about time of the visit. We honestly are not given enough time to do all that we need to do and want to do in a visit. However, I find that it still pays forward. If we can take the time to do a lot of these things, ask these questions, take time to explain, take time to hear where patients are coming from, it really does actually save time on the back end. You won't have as many phone calls, you won't have as many visits where things aren't getting done and management isn't going forward. There's definitely a benefit to actually taking the time. And sometimes, the powers that be shine on us and we get a little bit of extra time with a no-show, and it all ends up right within your scheduling world. But at any rate, it's worth it. It's worth it for your patient's health. It's worth it to try to get them to get the adequate care that they need.
Yeah.
I think it's a really important point to add too, that it's great when the main doctor or the main provider is doing all these things and doing them well. But going back to the beginning of the conversation, everybody in a clinical environment adds to this. And so, the diabetes specialists, the care coordinators, the navigators where they exist, the community health workers, the front desk staff, people who answer the phone. If every single person does their best to be health literate and clear in their communication, that creates an overall experience that's better for the patient. So I really think we have to be careful to sort of pile it all on, the doctor. The doctor has to fix this for everyone because there's a team here and there's a reason for that as well. And so if we give everybody a role and we all do our best, it sort of adds up in a good way for the whole experience.
Agreed. Yeah. And each person can practice a piece of it and gather a bit of information that, you may have been trusted by the patient in that moment to get. And that's what report and huddle is for, right? Because then we can combine our knowledge about, this person who we're trying to help. And that's how we make it even better and easier, right? For ourselves. And as I tell my colleagues all the time, it's monumental to resiliency, to provide a resiliency. Health literacy practice as a philosophy throughout the entire care team, including the clinician, including the clinical environment. It's something that brings us back to what we all signed up for, right? We are healthcare providers. We care for people because we actually care. We came into this field for a specific reason. And so if we want to see our patients do the best, we need to put in the work to make it happen. And that makes it wonderful to do and be working where we're working with whom we're working. So, yeah. That's why I love health literacy moment. So I think it's just been a critical part of my training. And I found myself this week and last week just kind of re-energized towards practicing the different strategies. So I actually had, I'll tell you a story, a patient who came in and the physician called me and said that she needed to go to the hospital because glucose values were really, really elevated and we were concerned. And so I kind of went back, I looked at her logs, right? She had brought all her logs. So she has been checking her blood glucose values. So she 110% is engaged, right? Because you don't prick your finger every day, multiple times if you're not engaged, okay? So I started looking and avoiding the numbers altogether. I just started looking for the trend. What is it that I'm seeing in these values? And what started to come to the surface was this trend of every third week, something happened. Every fourth week, something happened. And then like a first week and then I started looking at the dates and the first of the month looked fantastic, but the last end of the month, and I thought, let me ask an open-ended question of my patient. And so I said, tell me a little bit about how it's been for you accessing food with COVID. Tell me what happens when you go to the grocery store. And it was just an open door for my patient to explain that there were very limited food funds. She had cut hours at work, so she wasn't able to get food as much as she needed to provide for the family. And so every third or fourth week, they started running out. And so obviously every third or fourth week, you start foraging, right? You start getting whatever you can. And so what we got out of this interaction is I didn't need to lecture her about her glucose values. I didn't need to lecture her about checking and being adherent to her medication. She was, but her food choices were what we needed to tackle. And so we went online, typed in her zip code, found out that the Houston Food Bank has a pantry right in her neighborhood. That pantry also, here in Houston, they also assist with other resources, so electric bills, rent reduction, that kind of thing, to free up some resources for her food. And so we'll share those resources again. We've shared them before on previous, but I felt really, really good being able to help my patient in that way. And I know she did too. And she feels empowered. We have, staples that she's going to buy that she's going to bring out on the fourth week. And she'll be able to go to the pantry. And now that she knows about it, she can tell someone else. So you know, this is not something that we're just talking about for fun. This is life, you know?
Sounds like an incredible visit. And I'm a social worker by training. And as you tell me that, my heart dropped when you started describing the week, because I was like, oh, this is where this is going. But then just soared when you figured it out for her. And she was waiting for someone to help her for that. And so it's so joyful when you can make that happen and change somebody's whole family life. And for this patient, it was obviously a health issue, but all the people in her home were also affected. And it's not just today, it's down the road what happens with the kids in the home and everybody else. And so, you know, to your point, health literacy is such a sort of pivotal component of individual and family and community health. And it's powerful.
And in addition to actually, you know, helping her stay healthy, helping her family, supporting community health, you know, you also reinforced that trusting relationship that you saw her and you respected her and you wanted to know what was going on with her. And it wasn't like, you're doing this wrong, or, you know, you should do this better. It was just this, it was a conversation, right? And you wanted to get to know what the needs were so you could help her. And I think that you're making an investment in that patient and in that relationship that's going to continue to pay off with like the honesty that you have between you going forward too.
I was going to say that I know this may sound remedial, but it wouldn't hurt clinicians to learn some good customer service tips from a business perspective. I'm going to say this. If every time I went to the doctor, I felt like I feel at Chick-fil-A, oh my gosh, I would be like coming back all the time, you know, they greet you with a smile. You know, you can ask them so many questions about what's on the menu, because think about it. People are actually paying for healthcare. So why not make that experience, you know, a pleasant one? I know the reason why they're there is because either something's going on with their health or they just want to check up on it. But from a business perspective, like, I would go to Chick-fil-A just to buy something to drink because I feel good when I get there, you know? So it wouldn't hurt to have some good customer service tips. And like Dr. Gadabeku said about even the front desk person, because I know some people that have said, well, the doctor is okay, but the lady at the front desk was rude, so I don't want to go back. You know, and then when people say, okay, well, did you find another doctor? Well, no, I haven't. And then that kind of puts a break in the care, you know, so customer service is always good.
I just want to reiterate a couple points just made, and thank you, Serena, for saying that. And we all have to watch what we say, how we say things, our body language. In this telehealth age, like, what are we doing while we're on the video? Are we looking directly at the patient when we have our laptops in the room with the patient? Are we looking down? Are we making eye contact? How are we all just using nonverbal cues? Because the nonverbal cues can set somebody off in a minute and they're not listening to anything you have to say after that. So the customer service part is really important, and the stories behind the scenes is important, and this is for everybody, especially during this time. I think one of the hardest or the most challenging things about seeing patients right now, regardless of whether it's COVID related or not, is COVID. There's just a running theme, whether it's making people stressed, anxious, affecting food insecurity, affecting whether they're scared to even go to their pharmacy to get their medications, and even how it's affecting providers and staff, and what they're dealing with at home or outside of the office. So taking that time to, like Joy did, and you know, what's really going on, and asking about what's going on in patients' lives right now, because there are so many running themes, and we're seeing it manifested, but it's not saying this is because of COVID or this is because of this. And we do have to ask those behind the scenes questions, but realize that it's affecting all of us. And just checking in when I have staff that has an attitude, what's going on? and let them know, like, okay, I understand, but things are going on with these patients too, but really checking in with them and trying to help them ourselves. It's funny, I'm getting a lot of questions, even for me. How are you doing, doc? Are you staying safe? And that really warms my heart when patients kind of ask me, I'm here trying to help them, trying to figure out what's going on, and they don't even want to hear it. They just want to be like, how are you doing, doc? Are you wearing your mask? Are you going outside? And it puts a smile on my face, and it speaks to that therapeutic relationship that Susan was talking about, and can make us kind of stop in our tracks and have that that time to just be with people right where they are. And it makes a huge difference, and puts a stop to the grind of our day and our grind of trying to get through the visit in 15 minutes. But taking that breath and just talking about what's going on is really helpful on both sides.
Exactly. This has been such an important conversation. We have a viewer, who has been very grateful for our conversation, our recent thread that we've been talking about. Phobos says that they left their primary care after 20 years, and finding a consistent one is very, very difficult, likely because of the customer service and the real care that this person, that their previous clinician gave to them before, right? I know my OB was fantastic. I mean, every single time I walked in, I would get, granted, I was in Savannah, Georgia at the time, and they're just like sweet as pie. But, I would call in and they knew exactly who I was, Hey, Joy, you were last year. And it's like they just kept it in the back of their minds, because there's no way she was looking it up that quickly. And then she knew exactly when I was going to come back, and she always asked me about my baby and how my baby was doing by name, because she pulled that out of me before my baby was born. And so there's just, that level of care is it's intrinsic, but health literacy also helps to solidify it, right? To solidify it and create a path for it, even if it's not intrinsic to you.
I think it's so important to have a synergistic and therapeutic relationship with your provider and support staff. I do believe it can actually increase health literacy just by having that relationship. So this Phobos X, was fortunate to have this experience with a provider for 20 years. Some people don't even get that. And I understand how difficult it would be to try to find that again. But one of the things I tell patients, especially now I'm in the hospital and I'm asking, do people have PCPs? And a lot of times they're not going because they don't feel comfortable with their doctor, or they're not taking their medications because they don't feel comfortable with their provider. And it's almost like a bad relationship. You don't have to stay there. You should find a provider that works for you, where you feel comfortable, because the bottom line is, if you don't feel comfortable, you're honestly not going to do what you need to do for your health. So it is really important to find that either that provider, support staff, nurse, at least somebody in your care team that you have a therapeutic relationship and can trust and can ask questions to. And, I do really believe it helps with health literacy and healthcare management.
Yeah. And to Serena's point, as a clinician, it's your business model. You want to make sure that your business model and all the people who represent you represent, care and compassion and empathy. And so I think if as a clinician, you're at a point where you're able to assert leadership and decision making in your clinical practice philosophy and structure, I think it's very important that you speak up, for sure. So we have a viewer who's asking for us to give some resources where healthcare providers can learn more. So we have the ADA does a really good, has a really good handout that talks about common terms for medical words. So that will help you to use common language. We also, through our diabetes care and education specialists group, we have the power of words that we choose to use. And it helps to walk you through language that is supportive of individuals. We also have health literacy beyond the words, so navigating healthcare. And as we saw before, Katina's team has created excellent 2 to 3 minute videos, including about how to choose insurance, how to file for appeals, how to travel to your doctor's office for the first time, all of those types of things. Are there any additional ones that you as a group would like to share?
I think there are a ton of resources out there for providers. I will say also the American Medical Association, I think, has some resources. I think that they really picked up on this in the early 2000s as being something really critical. And a lot of their resources, some are a little bit older, but I think all of the best practices in those still stand. AHRQ also has some really good resources, like the Health Literacy Universal Precautions Toolkit is great. And that's great for sort of looking more at the organizational level, how your organization is doing, and can help you kind of evaluate, as we said, sort of every step in the visit process, what that looks like and how health literate it is and how you can improve that. So those would be two that I would recommend.
And I'd recommend for any provider in their organization for their specialty. Most of them have health literacy resources and toolkits as well. Like for me, the AAFP, which is American Academy of Family Physicians, the internal medicine counterpart, pediatric counterparts, OBGYN counterparts. I'm pretty sure all of the specialties have some resource available for related to this topic.
Super. Katina, do you have anything additional?
I think these are great, and everybody's given the ones that I would give. I think the real key is that you decide that it's something that's important to you, like other things such as cultural competence or specific skills, and you invest a little bit of time in thinking about it. And there are plenty of resources to do that. But once you sort of make the commitment, the best I can tell, you sort of remove the blind spot, and it gets very easy very fast because you sort of paid attention to it.
Yeah, and the tip that we always give to providers that are starting on this journey is I think it's really easy to get overwhelmed. You don't have to do and tackle everything all at once. Like you can start small. You can test some of these techniques with 1 or 2 patients a day, or if you have a cancellation and you have a little extra time in your schedule, you can start there. You don't have to go in on Monday and totally change the way that you practice. It really is about committing to this long term, recognizing that it's a marathon, not a sprint, and starting to implement some of those incremental changes.
Awesome. And I know just as something that I want to leave each of us with maybe like one sentence as to how you view health literacy as very important and critical, like the part of it that you like most. And I'll start. My take is that we as clinicians, especially since I'm in a location where there are trainees, we have the power to share and to model health literacy strategies and behaviors to improve people's lives to our trainees. And I think that we're called to do that. So in whichever way that we need to train ourselves up, practice it, we have the ability to influence future generations. So I think health literacy modeling is very, very important.
I can go next. I really
think from a patient perspective, You are your best advocate. So if your doctor's not going to know what's going on outside of the doctor's office if you don't tell them, don't communicate that to them. If you have questions, doctors are doctors. They are not mind readers. They're not psychics. So you have to let them know when you don't understand. Ask plenty of questions. There aren't too many questions to ask. There's not too many, and you can't burden the doctor with questions. I mean, ask as many as you like, enough for you to understand what you need to know.
Katina?
Sure. I get really excited talking about health literacy because it's one of the few things that you actually can contribute to, and you can make a big change with small actions. And I think you can make a big change in a person's life, but it's also a tool for social justice and health equity and all of the things that are sort of bigger than who we are as individuals. And so, I really want people to think about this and understand it, and sort of, as Susan said, grab a piece of this and start to practice it and see how powerful it can be in changing your interactions and changing people's lives.
Yeah, and for me, I'd like to emphasize again this message that this impacts every single patient, every single person. Incorporating these practices, helps providers feel more resilient and more fulfilled as well. Like, again, this is not, I think it's easy to other patients or to think that's to have this idea of the patients that struggle with this. And it really is something that everybody struggles with, and everybody benefits from communicating more clearly.
And I'll just say, just take the time in whatever part of the process it can, in preparing your space, preparing your patients, even before the visits, and preparing yourself, preparing your staff, and prompting your patients to ask those questions and to be advocates for themselves, and just trying to anticipate. It's time and anticipation that really helps on our end to achieve what we're trying to achieve with health literacy and healthcare management and improved outcomes. And it's really about the patients. And when you have that perspective, and that's, everybody has a key role. Everybody. That's one thing I press upon on my staff. You are a part of a patient's life, and it's about patients and their lives. And once you think about it that way, hopefully inspired to actually take the time and anticipate.
Awesome. Thank you so much, team. I have to wrap up, and I wish I could talk about health literacy all day, because it's something that's out everywhere and so very important. So I thank you all for taking the time to grow and to share health literacy from this sort of concept to real life that I think is so necessary to really move our healthcare systems beyond what they are just even today. So I can tell that viewers enjoyed it as well. So thank you so very much. Everyone, mark your calendars. We will be continuing to broadcast every Saturday, 10 a.m. Central Time and 11 a.m. Eastern. Our next episode will air on August 8th. Dr. AJ Rao with Temple University Health System will be back on our show to show his insights on how to manage diabetes during COVID-19. As always, we will be very excited to have him on. Please have your questions ready. We will try to, again, answer as many as we possibly can. The following Saturday, August 15th, we will explore the concept of the supersetting in prevention, specifically houses of faith, with Reverend Naomi Washington Lippart. She's the Director of Faith-Based and Interfaith Affairs in the Mayor's Office of Public Engagement for Philadelphia. And she will talk about the important role that communities of faith have when it comes to prevention of diabetes. And the following Saturday, August 22nd, Hope Galvan with Harris Health will explore the concept of food as medicine with us and share her experience working with the Houston Food Bank and other organizations to reduce food insecurity, which is rising among Harris Health patients. So thank you, everyone. I hope that you have felt that you are now a part of our family, a part of our My Diabetes HQ community. See you next time.